Hey guys, Dr. Nathan Thompson here with Exemplify Health Center, an affiliate of the Wellness Way. Happy Monday evening, guys. I know that I promised that I was going to be on at 7, but I'm going to be coming on just a little bit earlier. We're about 25 minutes earlier than what I was scheduled to, so I appreciate people who are jumping on right now. If you are watching right now, please say hello. Please let me know where you're watching from. Right now, we are streaming on Facebook at Dr. Nathan Thompson, Facebook at Exemplify Health Center. Which is the head of that clinic. And then also we're streaming live from YouTube. And then also what you can't see is what we're streaming live on Instagram as well. Guys, we have thousands of people who watch every single week. And guys, from the bottom of my heart, thank you guys for doing that. Thank you guys for some of your just wonderful, kind comments. Thank you for your questions and for your engagement. I sincerely appreciate it. And this week, I'm going to be going over the question, are you on a low salt diet? And guys, I'm going to try to get through this. You guys may, you may need to have to go back and watch this again because I'm going to have to go a little quickly to try to keep this under an hour. I should probably divide it into 2 parts, but why not just do it all now? So you may have to go through it, a little bit because I'm going to explain to you guys tonight the whole idea of low salt. When people say, "Oh, I'm restricting my salt," and I'm going to show you the physiology behind that, why it does lower your blood pressure a little bit, but really what it means instead. And I'm going to go over with you, maybe your doctor would put you on a low salt diet. And I'm also going to show you why blood pressure medications, what they actually do in order to lower blood pressure. A lot of them that people are on, really, when you look at the blood pressure, usually people are on 2 blood pressure medications, and literally how it doesn't lower blood pressure all that much. But I'm going to talk about minerals, okay? About minerals like sodium and potassium, especially, and how if you're deficient in this, some of the symptoms that you can have. But I'm going to talk about this whole idea with blood pressure and why a lot of people who follow a low salt diet, why it actually just ends up with them having high blood pressure, and why the doctor will put you on a blood pressure medication and actually over time probably need to put you on a diuretic as well. So guys, if you know people are on a blood pressure medication or people trying to restrict their salt, please share this video with them and just let them know to please just watch this video because I'm going to just talk about physiology and I'm going to talk about research. One of the interesting things as we wait for people to jump on right now is last week I went over, or maybe I just had done a video. I can't remember at this point. But I talked about a Harvard professor of medicine who did a study of 31,000 people. And he said, hey, we have people take cholesterol medications and, we're lowering their cholesterol down, but we're still having people have heart attacks. So who's having the heart attacks and who isn't, even though their cholesterol levels are so low. And the people who are still having the heart attacks are people who had very elevated high sensitivity C-reactive protein. And the people who weren't had very low high sensitivity C-reactive protein. And the Harvard doctor, this was in the Lancet Prestigious Medical Journal, he said, we're doing a horrible job in medicine of actually addressing C-reactive protein. Now, his solution was to give people anti-inflammatory drugs, but we get people's C-reactive protein down because this is largely a lifestyle immune system issue. And somebody had tagged a cardiologist on that post. And rather than actually looking at the research and actually listening to what I had to say, or even going and listening to the article, the only thing that he said, his only rebuttal is he's a chiropractor and not a cardiologist. How intellectually lazy is that? That you wouldn't even look at it because a chiropractor was reporting a medical study. And I know why he didn't want to look at that because he doesn't address C-reactive protein in the least bit, because all he says is you got to get you have to get your cholesterol down to 0. Okay. Down to 0. But the reason why doctors don't want to address that is because there really isn't anything to address elevated C-reactive protein other than lifestyle. Doctors aren't trained in do lifestyle other than to say, do the Mediterranean diet, do the DASH diet, exercise, maybe just do some of those things. But they can't get into the nitty gritty as far as why that could be elevated and start lowering in people. We have lowered it from 27, to under 1. And we do that, consistently lowering it because we understand inflammatory triggers and how to lower that just based off of lifestyle. So if you're watching again, just guys, make sure that you say hello and let me know also where you are watching from. We're going to talk about, are you on a low salt diet? That's the question that we're going to ask. And guys, make sure that you please share this video. You can also see the replay of this on YouTube. I know that we're streaming live right now from YouTube. And you can also go back on Rumble and watch this as well, because we have all of our videos archived. In fact, including some on Rumble that you won't see on YouTube because YouTube banned it at 1 million to 2 million views. And I know exactly why they actually banned it, because people tell me right now, hey, Doctor, should be on Rumble. I'm like, we are. We have been on Rumble for the last year and a half. And we probably have an archive of probably 75 or 80 videos on there. So guys, make sure that you follow us over there and you'll get updated with new videos. You'll see this update in the next 2-3 days on YouTube and on Rumble. So you can go back and watch it. It might be a little bit easier to watch it on that platform. And the other thing, a little bit of housekeeping, is our next inflammation talk is tomorrow at 6:00 p.m. It's an in-person event, inflammation talk. Guys, it's the first step that you need to do in order to get your health under control. The number one reason why people come into the office, you know what they complain about? Fatigue. They complain about fatigue. And usually when I say, hey, remember when you had the flu? Or remember when you had that other thing? You remember how fatigued that you were? The reason why you're so fatigued is you're so inflamed, the adrenal glands down-regulate as a result. And so people think, oh, I have adrenal fatigue, or no, you're inflamed. That's the first thing that you need to address. And so whether it's weight loss, resistance, whether it's cancer, infertility, thyroid issues, arthritis, type 2 diabetes, autoimmune conditions, hormone imbalances, things like that, it's all tied to inflammation. And I've even had some medical doctors say, inflammation is good, it's needed, it's normal. And I'm like, yeah, it is when it's acute, but if you're never handling inflammatory triggers, the immune system's not designed to shut off. It will always go after those inflammatory triggers. And that's when chronic inflammation can cause a host of other problems, including what I'm going to talk about today, which is going to be high blood pressure. So if you haven't registered for that, it's an in-person event. Make sure that you're registered for it. And if you can't make it for tomorrow night, our next one is already pinned, I think, to the top of my page at Dr. Nathan Thompson on Facebook. You can go there. You can go also on Instagram. Just follow the link tree and you will see upcoming events. The next one, I believe, is April 27th, which is a Thursday at 6:00. So guys, this right here is the one of the most game-changing things you can do once you start knowing what inflammation is, what causes it, and how to start lowering it so that you can start to initiate a rebuilding and repair process. So I wanted to talk about this whole low salt type of thing and why it can actually lead to other problems. And so if your doctor says you need to be on a low salt diet, you need to restrict your sodium, I'm going to show you the initial research as far as why that was. And it comes from a study called the InterSalt study. And I think that this was done, I want to say, I think in 1984. And guys, just so you know, if you went to Time magazine in 1984, they told you to be on a low fat, high carbohydrate diet. And then they switched to a high fat, low carbohydrate diet. Then they said that eggs are bad. Then they said eggs are good. Bacon bad, bacon's good. You realize it's changing all the time. And so this is a research article, a research study called the InterSalt study that came from 1984, right around that time. And this is one of the reasons why people started saying you need to start restricting your salt. And when you look at this study, basically how they came up with this is they took all of these different regions, like 32 countries, and they looked at how much sodium that they were excreting. And so what they found is the higher amount of sodium that a person was excreting, the higher, generally speaking, that their blood pressure actually was. And they found that the lower amount of sodium that they were excreting from their urine, then the lower blood pressure. Now, what actually caused them to make this decision was the fact that they took the 4 different groups of people who had the lowest blood pressure and also the lowest amount of sodium excretion from their urine. The only problem is that the 4 populations that they made this decision from was from the Yanomamo Indians, the Xingu tribe, the Kenyan tribe, and then a tribe in Papua New Guinea, which is basically just indigenous tribes devoid of technology, ate a very low sodium diet. But the other interesting thing is when they looked at their blood pressure, these indigenous tribes also were not obese and drank no alcohol. But the other kicker was that their average lifespan was about 52 years of age. So they probably died of infection or some maybe even malnutrition or something that would actually require fire department care, which, guys, you need that. But the problem is they really weren't even living long enough in order to develop heart disease anywhere, or these chronic inflammatory conditions, which means like if you make it long enough, you're going to be struggling with these things. And the reason why you do see more heart disease and cancer and things like that is because the medical system does a really good job of putting out fires, but does a terrible job as far as rebuilding the body after the fire has actually been put out. So here are some of their conclusions, from this InterSalt study. Number one, they say this is the less that they were excreting potassium from their urine, we saw that there was the same decrease in blood pressure. Okay. The other thing that they found is that also when they increase potassium, hang on to this one, they saw a decrease in blood pressure as well. Hint, hint, because you don't see doctors telling you about increasing your potassium. In fact, they'll tell you to run away from it, especially if you're on some kind of blood pressure medication like an ACE inhibitor or something like that. They said that blood sodium potassium ratio was significantly related to blood pressure of individuals, because when's the last time doctors actually talked to you about your sodium potassium ratio? And then they also made the brilliant discovery that body mass index and high alcohol intake were also significantly independently related to blood pressure of individuals. So guys, when you look at blood pressure, salt is not the only thing that can cause high blood pressure. There's a lot of other factors. And in fact, I remember talking to a guy, doctor wanted to put him on an ACE inhibitor with high blood pressure at about 28 years of age. And I looked at him and said, it's not working, is it? He says, hasn't budged one bit. And I said, well, the reason why has nothing to do with salt, or has nothing to do with inhibiting specific enzymes in the lungs. It actually has to do with the fact that you're having a stress response, and we need to figure out what that stress response is. And probably this blood pressure medication would have worked better. However, we really don't want people to be on long-term medications. Like, we try to help them get off of medications. That should be the whole goal of healthcare, right? The whole goal of healthcare, doctors say, listen, Bill, I'm going to put you on this blood pressure medication. It's way too high, but you know what? I don't want you to be on it for the rest of your life. And in fact, we're going to figure out what's causing it. And I'm going to, go to the ends of the earth to help you change things so that you don't have to be on these medications for the rest of your life. So when you continue to look at this study, there's what the conclusions from this InterSalt study from 1984, which is why, people went into this whole low salt type craze and then leading into what's known as the DASH diet. But here were some of their conclusions. Number one, they said this: average sodium intake should be reduced substantially over time. Okay. Just based on basically those four tribes specifically that they picked to get that data from. And they also should say we should be lowering salt even in childhood and in infants. We should encourage that. Now, that's something I'm going to show you I 100% disagree with. They also said this, though: there should be encouragement of increased consumption of fruits, veggies, and other natural foodstuffs with high potassium content, which I do agree with as well. And then obviously they say avoidance of obesity. That's a no-brainer. And then all possible steps should be taken to avoid heavy alcohol consumption. Wow. I didn't know that we needed a study in order to figure that out, that you shouldn't be obese and that you also shouldn't drink high amounts of alcohol. And you should eat lots of fruits, veggies to get potassium. But the whole idea of severely restricting salt, I'm going to show you why, in my opinion, that's kind of a crazy idea. So this actually goes into the DASH diet. In fact, a lot of medical doctors, what they're going to recommend is they're going to recommend a Mediterranean diet and or a DASH diet. Okay. DASH diet, if you've never heard of it, I pulled this up from the Mayo Clinic. The DASH diet stands for Dietary Approaches to Stop Hypertension. Okay. Dietary approach to stop hypertension. And it parallels a lot the Mediterranean diet. Guys, one of the reasons why the Mediterranean diet or even the DASH diet could work is someone says, well, I did it. I got amazing results from it. One of the biggest things with Mediterranean diet and the DASH diet is it just basically says stop eating junk food. So don't eat junk food and eat more fruits, veggies, and whole grains, which of course it's going to work because we live in a country that we eat a lot of junk food and ultra processed foods. There's no doubt about it. So from the DASH diet, one of the things they want to focus on is restricting sodium. And so here's what they say: the DASH diet is a lower in sodium diet diet than the typical standard American diet, because the standard American diet, the average consumption of sodium is 3,400 milligrams of sodium. Okay. Now the question is where are we getting that sodium from? We're not getting it because we're putting too much salt on our food. I can guarantee you that where we're getting some of the sodium from is from processed foods. One of them is going to be monosodium glutamate, because foods are going to be highly contain a high amount of sodium when they are ultra processed. Now, the standard DASH diet says, hey, we need to limit your sodium intake to 2,300 milligrams of sodium per day. But a lower sodium version of the DASH diet restricts sodium to just 1,500 milligrams a day. What's so crazy about this, because actually, I'm going to show you and pull the research what the National Institute of Health says how much potassium you should be getting a day. And then they also say your ratio of sodium to potassium should be at about a 1-to-1 ratio, which means what they recommend right here would be a third of what the National Institutes of Health recommends as far as how much potassium that you are going to be getting. So this is what the DASH diet is. And in fact, they're also saying, hey, we're restricting some foods and things like that. But maybe a big part of the reason why a DASH diet can work, or why this is one of the top 2 diets that a lot of people in medicine are recommending, is because you're also saying, hey, please get rid of ultra processed foods, which is going to work for a lot of people. So this is another study that I showed about the DASH diet. So the DASH study that they did, one of the things that's amazing is that it was a study that they pulled from 412 people. Okay. So a lot of times, guys, when you look at, some of these studies, like a specific, what that was recommended in kids, and they pulled the study from 8 kids and they said, yeah, they're fine. So therefore we're going to recommend this for emergency use authorization, clear across the board for every child. Well, the DASH study involved 412 people. Here's what they actually said. When they looked at the people, they divided them into 3 different groups. The first group, they basically said, hey, we're going to give you a diet has a lot of junk food, has a lot of meat, a lot of sweets, and things like that. And they said, hey, we're going to give you a diet that's rich in fruits and veggies. And then we're also going to give you a diet that's rich in fruits and veggies. That's also going to be high in defatted dairy, so like skim milk, things like that. And so they're saying we're going to take a little bit step further, add in some dairy, add in some. Sorry, my light keeps coming off when I don't move. But basically, what they said is they kind of put them into 3 groups, and they already stacked the cards against the people who were meat eaters, because they had to be meat eaters and then also eat a lot of junk food as well. So one of the things that they found, they said in the group using a diet rich in vegetables and fruits, systolic pressure dropped. Now listen to this: 2.8 millimeters of mercury of that top number. Okay, systolic over diastolic, that top number on that blood pressure. So if it was at 125, it went down to approximately 122. Now, the other thing they said, in the group that used DASH diet, reduction of systolic blood pressure was 5.5 on average millimeters of mercury. So it went from 130, or 125 down to 120 or 121. And then they said, but the effect was most visible in people who had hypertension. Well, who are people who are going to have hypertension? Most likely, they're going to be overweight. They might be consuming a lot of processed food. They might have some blood sugar issues. They may have fatty liver and things like that. And they said, well, the biggest change that we actually saw is we saw a lowering of that top number by 11 to 12% or millimeters of mercury. You might be looking at this and saying, wow, that's not a lot. And it's not, because a lot of people may have high blood pressure at 150 or 160, and it's really only lowering at 10 to 12 points on that top number. But here's the kicker: if you are watching this on Facebook or YouTube, the kicker is that this reduction in blood pressure is comparable with the use of 1 to 2 antihypertensive drugs. Isn't that amazing? Because a lot of you might be taking an antihypertensive drug, a blood pressure medication, and you're like, yeah, it's not moving it very much. Well, the average model of reduction of blood pressure by taking 1 or 2 antihypertensive drugs is only 10 to 12 millimeters of mercury off of that top number. Guys, I mean, I can even show you research that came from the University of Chicago Hypertension Center, George Bacchus, and they actually did a study by adjusting the top part of the neck, the atlas bone, because it helps you get into rest and digest. They actually saw a similar reduction of blood pressure by 10 to 12. They even reported on it on Good Morning America. Then you never saw it again because this was 10 or 15 years ago, because heaven forbid we actually do something that doesn't involve any kind of medication. But he even said, this is unbelievable. We're seeing a lowering of blood pressure 10 to 12. That is usually what happens when we have to give people one or two different blood pressure types medications. So you can actually see how much is it actually lowering blood pressure. Reality is that it's not as much as what people think that it is. And so what foods have sodium? This goes back to the Mayo Clinic. What foods have sodium? Well, Mayo Clinic says, well, the foods that are going to have the highest amount of sodium are going to be from processed or pre-prepared foods. These include things like bread, they're going to things like pizza, cold cuts, bacon, cheese, soups, fast food, prepared dinners such as pasta, meat, and egg dishes. So which ones have the high amounts of sodium? Usually the ones that have flavor enhancers like monosodium glutamate as well. And so where a lot of people could be getting possibly too much salt isn't the fact that they're putting salt on their food as much as they're getting added salt that is in crappy food. And so you have to consider, well, maybe it is the salt, but maybe it's also if you are having things like bread, pizza, uh, cheese and soups and fast food, you're probably going to be consuming a lot of ultra processed carbohydrates. You're going to be consuming a lot of sugar. You're also going to be consuming a lot of wheat gluten. You're also be consuming probably a lot of dairy as well, which a lot of people do have an IgG food allergy to. And so, the salt is also tied to really bad food. So the point I want to make from this is, okay, wow, which foods have the most amount of sodium? Well, you shouldn't be eating these anyway. All right. So don't eat those foods, especially. So getting into the whole debate when it comes to salt, I made this kind of, funny analogy because, guys, if you even go back to nature, nature will leave some clues. For example, if you see a lion take down a gazelle, in the African Sahara, the first thing that they eats is he eats the organ meat because it's the most nutrient dense. It doesn't go for the breast or doesn't go for the thigh. It goes for the organ meat, specifically usually the heart and the kidneys and the liver. That's what it's actually eating first. And guys, if you go out into nature too, you're going to see that a horse or a cow or a deer, if you put a salt lick out, you're going to see that it's going to go to that salt lick and it's going to lick it because our bodies need sodium. And I'm going to show you why they do need sodium. So this is just something that maybe it's funny, maybe it isn't. I hope my doctor doesn't see me doing this, which is a horse that is licking a salt lick. Okay. Now, this goes back to when people don't understand what salt is, what's the function of salt, then they tend to try to restrict it as much as possible, thinking that somehow it's going to magically lower their blood pressure. But you have things in place for sodium and potassium regulation because your blood pressure needs to maintain a certain within a certain range just for normal physiological function. So what do we need salt for? Here's the first thing. You need salt for your nerve system to work. If you go back to Guyton and Hall's medical physiology, they talk about along the membrane of the nerve, you have what are known as sodium potassium pumps because it pumps sodium in and out, potassium in and out in order to make an electrical voltage, which is how your nerve system actually works. So this is your peripheral nerve system, this is your brain, and then this is also, things that are responsible for heart function and things like that. So we need salt for our nerve system. Here's what's also interesting is you also need salt, guys, for stomach acid production. This is absolutely huge because you need salt to make stomach acid, which means you go on a low stomach or low salt diet, you may not be able to produce enough stomach acid, and in which case you're going to get acid reflux, which you're going to then go on a proton pump inhibitor, and you're going to think that that's taken care of. But it always makes me wonder if someone does have some problems with stomach acid production and it's causing acid reflux because it just keeps getting regurgitated because you can't sterilize your food enough or break down your food enough, how that can also cause problems with reflux, and they go on another medication that's going to have other side effects as well. And I wonder how many people restricting their salt are actually having things like acid reflux. In fact, if I see someone who's got acid reflux, there's a lot of other things that we can do in order to help with that. But I'm like, you should probably be getting your levels of salt up as well, not regular table salt, but in the form of sea salt. And I'll explain to the why in just a second. But guys, you also need salt for heart function. I'll explain that to you in a second, because if you do have some level of electrolyte balance, and what we're specifically talking about here is sodium and or potassium, here's some of the symptoms you can have: nausea, vomiting, headache, confusion. Here's a big one: fatigue. Specifically, if you don't have enough potassium, here's another big one: restless leg syndrome, in which you're laying in bed at night and you feel like your legs have to move all the time. So many people suffer with restless leg syndrome, saying you need to be getting more sodium, you need to be getting more potassium in order to help with that function. How about muscle weakness, spasms, and or cramps? Muscle weakness, guys, is huge. There's some people, especially athletes, who come in and they're saying, man, I actually should be a lot stronger than what I look like. That was even my case too. And I realized, man, I am so low in potassium. I'm not getting enough potassium as well. And then even into seizures and even coma. Here's something that's really interesting. I've even had a couple of patients who were marathoners, who were training for a marathon, and then during the marathon suffered a seizure, probably because they were so electrolyte deficient. They go to the doctor, they put them on anti-seizure medication, not even caring about what they were doing during that time or how they were training beforehand, and just said, we're going to put you on an anti-seizure medication and you're always going to be on it for the rest of your life. And it just makes you wonder, when a person has one seizure, if they're even considering whether that person has some level of electrolyte deficiency, because there's a lot of different reasons why that can happen. So what are some of the causes of having electrolyte imbalance? Well, if it's sodium, being on a low sodium diet will definitely do it. Dehydration from exercise or sweating or heat. But guys, just as the same, you can overhydrate, which is why when people say you need to get your 150 ounces of water, of just plain water, and I'm like, are you putting any other electrolytes, any other salt, any other potassium, even magnesium? Are you putting that with that? Because that's why we always say quit drinking plain water all the time. Medications can cause sodium issues. Kidney disease or liver disease can definitely do it. And guys, when you have literally half of our country who has either the initial stages or advanced stages of non-alcoholic fatty liver disease, well, there's one of your problems right there. And also, if you have kidney disease, which is the number one cause of kidney disease, type 2 diabetes, that can do it. And then also, guys, even stress can do it. Now, low potassium or potassium problems with an imbalance of potassium, having a low potassium diet, which you'll probably realize that most people actually are, especially when they took those group of people in the DASH diet and said, hey, you're not going to have a lot of fruits and veggies. You're just going to have a lot of junk food. Well, of course, they're going to become potassium deficient, because I'll go over the best sources of potassium in just a little bit, but also the use of diuretics, okay? And laxatives, having chronic diarrhea can make you potassium deficient, as well as stress. So getting back to that's very easy, for people to be deficient. However, one of the hardest things is actually measuring your sodium and measuring your potassium levels. This is one of these things where we say you can't test it. And the reason why is potassium, for example, is you can't test it in the blood because 97% of it is within these cells. And they even admit that we can't, there's not a good way to be able to test it because it's intracellular and it's not necessarily in the blood. So when you're talking about blood pressure control, guys, where that primarily is happening, where that control center is taking place, is actually in your kidneys. It's your kidneys that's regulating your blood pressure. Okay. Here is what's so interesting. I had an aha moment last night because I've had doctors say there's no need that you need, or even nutritionists, there's no need that you need a detox. You can do that for free because your liver and kidneys do that. And I'm like, well, that's really interesting, because in the same logic, You also tell people that you need to restrict your salt because your kidneys can't do it. So it's like, which side of what side are you on here? Because at one aspect you say, well, they can do it, but in the other side of your mouth you say that they can't. So, however, can some people have some problems with their ability, to be able to regulate their blood pressure because they have kidney damage? The answer is yes. It's yes, but you got to figure out why they have some level of kidney damage. But when you see this, it's like, what's the narrative that you're going to go with? Because if the kidneys and liver can do it, then the kidneys and liver should be able to do it indefinitely. So you can't pick your spots in which you need to try to manipulate physiology because it just fits your narrative. So I want to go over with you how the body controls blood pressure. And I see a picture up here. I want you to stay with me as much as possible because you may have an aha moment. Because when you talk about, hey, the doc put me on an ACE inhibitor, and I have no idea how that works. But I want you to think of this. This is if the body needs to increase your blood pressure, which is not necessarily a bad thing. So if you look at how the kidneys actually do it, the kidneys can secrete an enzyme. It's called renin. And then you have a protein that's made from the liver. The liver, which the liver does a lot of stuff called angiotensinogen. And then the renin, what it does is it actually cleaves that off into what's known as angiotensin 1, which is the inactive hormone. And then what happens is within the lungs, you have something that's known as angiotensin converting enzyme, or ACE, and that actually makes angiotensin 2, which is the active hormone that then acts on the adrenal glands. Look at how intricate this is. And then the angiotensin 2 works on the adrenal glands. For the adrenal glands, the very outer part of it, to secrete a hormone known as aldosterone. In fact, when I say, hey, what do the adrenal glands do? Everyone just says it's cortisol. It's cortisol. But guys, the adrenal glands are unbelievable. This is like a hormone powerhouse because they're making things like aldosterone, they're making estrone, testosterone, cortisol. The inner part is making norepinephrine and epinephrine. I mean, it's incredible what the adrenal glands are. When people say your gut is your second brain, I'm like, that is not true. It's your adrenal glands because it's actually part of it is neurological tissue. So it works on the adrenal glands, and then the adrenal glands secrete what's known as aldosterone. And then aldosterone then signals the kidneys to hang on to sodium and get rid of potassium. And essentially, if you hang on to sodium, then what it does is it's going to expand your blood volume and your blood pressure is going to go up. And so it's always doing this feedback loop, like a Swiss watch principle, all the time in order to keep your blood pressure regulated. Okay. So I want you to think of this. If you know that physiology behind that, you understand that. I want you to think of this. If you are restricting, especially unrefined salt, and you say, I can't have any salt, it's so terrible for me, then one of the things that's going to happen is your body is going to try to hang on to salt. And that will actually, over time, raise your blood pressure. And it will then actually cause more potassium excretion. So you can become potassium deficient and actually cause high blood pressure as a result of unnecessarily restricting so much salt. Something that you need to think about. I'm going to show you the research article in just a second. So here's what's so interesting, because when they say you need to restrict your salt, the National Institute of Health actually says, hey, you know what? Well, here's how much potassium that you need every single day. If you are from 19 to plus 51 plus, so 19, after 19 years of age, you're going to need, if you're a male, 3,400 milligrams per day. If you're a female, 2,600. That's considered the RDA. So you need that. Now, that can be different, which you'll notice, hey, wait a second, my doctor said I'm on a blood pressure medication. I need to restrict my potassium. And I'm like, that's how crazy it gets when you are on a blood pressure medication, that you should be restricting something that you need and that your nerve system also needs as well. So one of the things that they say is they say this, again, National Institutes of Health, assessing potassium status is not routinely done in clinical practice and is difficult to do because most potassium is in the body inside of cells. Although blood potassium levels can provide some indication of potassium status, they often correlate poorly with tissue potassium stores. which if your doctor is trying to look to see if you have too much potassium, they are looking at blood potassium only. And guys, where your most of your potassium is at is intracellularly 97 to 98% of that. So what happens then if you have a potassium deficiency? Here's what they say. Now listen to this. Insufficient potassium intakes can increase blood pressure, can increase kidney stone risk, bone turnover, urinary calcium excretion, which can lead to osteoporosis, and also salt sensitivity. Okay. Meaning the changes in sodium intakes affect blood pressure to a greater than normal extent. Wait a second. When they were looking at this during that inner salt study, were they also looking at how much potassium was getting excreted as well? Did they actually know if these people were potassium deficient? Because even then, adding a little bit of salt, if they're potassium deficient, will cause an increase even more of their blood pressure, which is why maybe doctors are saying, oh my gosh, you need to get it even lower than 12 or 1300 milligrams per day. Now, hypokalemia, which means low potassium, actually affects 21% of hospitalized patients, usually because of the diuretics and other medications that they're on, which makes you wonder what kind of medications are people going to the hospital for, and how many of them are on some things that can cause problems with potassium. Mild hypokalemia is characterized by, now listen to this, guys, even if you're mild potassium deficient, characterized by constipation, fatigue, muscle weakness, and malaise. Okay. Malaise means, I just feel like this. Moderate to severe hypokalemia, kalemia, listen to this, cardiac arrhythmias. So, cardiac arrhythmias, interesting. Severe hypokalemia can be life-threatening because of its effects on muscle contraction and also cardiac function. Now, here's what's also interesting. Now, magnesium depletion. Now they talk about magnesium can contribute to hypokalemia, meaning if you're not getting enough magnesium, you can also makes you deficient in potassium by increasing urinary potassium loss. Because I know someone's going to want to talk about magnesium. It can also increase the risk of cardiac arrhythmias by decreasing intracellular potassium concentrations. So more than 50% of individuals with clinically significant hypokalemia or low potassium might also have magnesium deficiency. Isn't that interesting? Because think of this, okay? Think of this, that when this is happening, low potassium and low magnesium can cause cardiac arrhythmias. But when's the last time someone comes in, they have a cardiac arrhythmia, and immediately they want to put them on, let me change one thing here real quick. They want to put them on something for having some kind of cardiac arrhythmia. And they want to put them on blood thinners. They want to put them on these different medications. They want to put them on all of these different things. And usually it's for lifetime. But have they actually even checked the fact that they might be potassium deficient? And might they also be magnesium deficient as well? So that comes from the National Institute of Health. So I want you to think about it, is that you start restricting certain things, and you'll start causing other changes that take place into the body. So even restricting your salt and being potassium deficient can actually cause an increase in blood pressure. And the cycle starts is, hey, we're going to put you on blood pressure medication. So the blood pressure medication they might want to put you on is ACE inhibitors, angiotensin 2 receptor blockers, beta blockers, calcium channel blockers. But all of these guys will cause something interesting, and that is also known as water retention, which means now once you start retaining water, you're also going to go on a diuretic, which is why very few people are on one blood pressure medication. They're on two. Some of them are even on 3 blood pressure medications as well. So the question is this: why do my doctors tell me to avoid potassium? I'm going to show you why. because the reason why someone should avoid potassium isn't because of anything in nature. It has to do because the doctors now have put you on a medication that is causing sodium to be excreted and for you to hang on to more potassium. So what they're trying to do is your sodium is way up here, your potassium, because you're so deficient, is way down here. And they say, we're going to get rid of that salt and we're going to help you hang on to that potassium and try to bring it back to a 1-1 balance. Where I'm saying, well, what if you actually just did this because you're so potassium deficient? Because remember, your body actually needs salt. But again, just like I said, 97% of your potassium is not in the blood, but they're trying to measure it in the blood, but it's not in the blood, only 3%, which makes it nearly impossible to truly assess your potassium store. So I want you to think of this. Here's how your blood pressure medication actually works is number one, blood pressure medication like an ACE inhibitor actually will block the receptor or block the enzyme, okay? An ACE inhibitor, angiotensin converting enzyme inhibitor, which means you're not going to get the angiotensin 2, and then it's going to cause a decrease in aldosterone, which then will cause you to be able to excrete more of your sodium out, and then retain more of your potassium. And this is the reason why they say you got to be really careful about eating anything with potassium. I've even had doctors who say you should be eating no potassium whatsoever. I'm like, really? Are you really telling, this person not to eat anything that grows from the soil? Because really anything that grows from the soil is going to contain potassium. Avocados, broccoli, legumes, beans, all of those are going to be potatoes. All of those have sources of potassium that are in it. And so then what happens is that when you look at this, okay, that's the reason why. But now what happens is that's why the doctor says don't have any more potassium, because you can become close to death if you get your potassium levels actually too high, not realizing that most of it is actually intracellular anyway. So here's an interesting study, okay? This is what's very, very interesting when you look at this, okay? This was from Cochrane Database Systematic Review. And you guys look at Cochrane Review, they look at tons of the data on there. This comes from 2011, okay? So now they had a little bit of time to look at dietary restriction of salt. And again, this was 12 or 13 years ago, but here's actually what they found, okay? They said, yeah, if you restrict your salt, we do see that your blood pressure goes down. And we're talking about not even double-digit points, with this. So it wasn't making a huge difference. However, when they measured certain hormones in the blood, here is actually what they found. Is they found that the amount of renin that was secreted by our kidneys went up 304%. That aldosterone coming from your adrenal glands went up 322%. Your noradrenaline or norepinephrine went up 30%. Cholesterol went up 5.4%. So your cholesterol actually increased by going on a low salt diet, but they have also a fix for that. And LDL, so total cholesterol 5.4, LDL went up 4.6%, which that actually could increase your cholesterol by 15 points or so. And then it also caused a borderline increase in adrenaline. So it was causing this stress hormone in adrenaline by 12%, but it also increased your triglycerides. So it increased triglycerides. Well, the things that your doctor is telling you about is you got to keep cholesterol down, you got to keep your triglycerides down, and things like that. And it increased it by almost 6%. So here it is, basically it's increasing the stress on the adrenal glands as a result, and also increasing triglycerides and LDL that your doctor wants that to be so incredibly low, all because you're going on a low salt diet. And I want you to think of this. Even if you're increasing epinephrine, also known as adrenaline, you are increasing the fight or flight response inside the body. So what happens with that? Slow digestion, low stomach acid, increase in your heart rate, increase in your blood sugars. You have an overstimulated nerve system, and also you're going to get a hormonal response on many, many different levels as a result. So here we are trying to restrict salt, and it's actually increasing a stress response. And the last time I checked, here in the United States, People generally don't need a higher stress response, nor do they need their adrenal glands stressed even more. And when you look at all of this, guys, the biggest thing that I can tell you is this, is that never look at your body as a this for that. This is why I always just shake my head when people say, what supplements can I take to lower my blood pressure? Once you understand the Swiss watch principle, you're going to understand that anything can create anything based on how the body works. And this is why we say, hey, the big toe controls your heart. People are like, oh, that's so stupid. I'm like, okay, come here. Let me take a hammer. Let me hit your big toe, excuse me, as hard as I can. Let's check your blood pressure and let's see what happens. Because, guys, when you are looking at blood pressure, there is more than one thing at play here when it comes to blood pressure. Is it truly a salt issue? Are you have too much salt? Or maybe you are having too much processed foods. Maybe you're deficient in potassium. Maybe it's an inflammatory issue. Maybe it's swelling of the arteries. Maybe it's actually due to endothelial dysfunction taking place along the vascular lining. Maybe it's even a stress response. Maybe it's actually coming from too much mental stress. And this is why there's so many different things that can be at play. And I'll give you a perfect example because this happened not too long ago. But a guy was taking two different blood pressure medications. Blood pressure was sitting at about 140, even being on a blood pressure medication, 140 being that top number. And I remember we started working on some things, working on his lifestyle. We also said, here's some things that can actually start to lower the blood pressure a little bit quicker. And within about 4 weeks, he calls me up and he says, hey, doc, I'm getting really, really dizzy here. I think it's what you are doing that's causing me to get dizzy. And I said, it absolutely is. And the reason why is that your blood pressure is going down and then your medication is manipulating it even lower. Just remember this, medications manipulate. They don't work with the body. And so he was getting dizzy because I said, take your blood pressure. And sure enough, his blood pressure was at about 95/60, which meant every time he had to change direction, getting up from a seated position or getting out of bed, he was getting extremely dizzy. And so I said, now you know what you need to do. You don't stop what you're doing that's getting you healthier. Now you need to talk to your doctor and stop those things, because the great thing is you don't need it anymore. And sure enough, now 3 to 4 months later, he's on no blood pressure medications. What's interesting is a lot of doctors get mad at that. Okay. Now, just remember this, I don't have the authority to be able to take people off of blood pressure medications and things like that. Your doctor should be tickled to death that, oh my gosh, you have gotten actually healthier. I love getting people off of medications. I absolutely love it. But sometimes the only thing that they can say is who did that to you? And here's what's so amazing is in 20 years of clinical practice, I've only had two medical doctors who called me and said, tell me what you're doing because I want to do this with my patients. And in fact, it actually never got past the phone call, because when they understood how much work that it did, and it was also based on the patient and not just a magical herb, a magical supplement, or just some weird medication or something they hadn't heard about, then they don't care, because it takes a lot of work and it doesn't pay. You can't use insurance to fix your lifestyle. And a lot of them are actually dependent on that. And I wish more doctors, because to me, it says if something work, I don't care where I'm learning this from. Like someone says, we have the fix for this. We know how to do this. And they could be a plumber. And I would listen to them because it always would be what's best for patients. It's best for people, not what's best for my paradigm. That's where healthcare goes wrong, is because we say, well, I'm a chiropractor. I need to stay in this paradigm. I'm a medical doctor. I have to stay in this paradigm, versus saying, what is best for the patient, regardless of what my paradigm is. And the more that we start to say, hey, what is best for the patient, then we'll start to become healthier as a country. But when you look at the Swiss watch principle, you can see there's so many things at play, in which if you're sick and you're suffering, it's not one thing. There's many things at play. There's many factors that involve, which is why, guys, you need to stop looking for the magical supplement that's going to take all your problems away, because honestly, it doesn't exist. So what do you need to do? Number one, I will say this is work with a Wellness Way doctor. Go to www.thewellnessway.com and please, guys, find a Wellness Way doctor near you. There is now over 50 to 60 offices that will grow probably double within the next 1 to 2 years, conservatively. But see if you can find a doctor that's near you. And if you can't, there are doctors who do remote consults only. People ask me all the time, Doc, do you do remote consults? And I'm like, I don't need to right now because our in-person consults are full, but it doesn't mean I won't do it down the road. But there are other doctors who say, sure, we can do a phone consult. We can get the tests that you order from, go over those lab results with you, and then put you on a plan as far as what you need to do depending on what's going on with your lab results. We always say this, guys, we don't guess, we test, but we test a whole heck of a lot deeper. So what are some of the things that you can do? Let me preface by saying this, is that if you are on some kind of blood pressure medication, don't listen to this, okay? If you also have type 2 diabetes, this can also influence this as well. So you may not want to do this as well. And this is why we always say, please work with a Wellness Way doctor, okay? Because I know some people are going to message me and they're going to be like, this is my history. What should I do? I don't know. I haven't looked at your tests. But I want you to just think of this. The salt recommended daily allowance actually comes to about 1 to 2 teaspoons of unrefined salt, okay? Because unrefined sea salt, I should say, because not all unrefined sea salt, 1 to 2 tablespoons, it's not all sodium, okay? So about 1 teaspoon of unrefined sea salt has about 2,000 milligrams of sodium. Now, even if you're going back to say, I'm going to try to get my balance of sodium potassium to 1:1, some of you are actually going to need 1 teaspoon, some 1.5 to 2 teaspoons of sodium every single day because the RDA is actually, you are looking at approximately 3,500 up to even for some people, 4,500 milligrams of potassium, especially if you are working out quite a bit and you are sweating quite a bit. But the main thing is, guys, is that you need sodium, you need potassium for your body to work. Hopefully, I've established that. But the biggest thing that you need to do is you need to find the cause of high blood pressure. You need to find the cause of the high blood pressure, and it's not just salt. There's many, many factors that can be involved, whether your adrenal glands, inflammation, arterial dysfunction. There's a lot of different reasons why it happens. And that's why it basically comes down to physical, mental, chemical, physical, mental, chemical. Heck, even issues with the nerve system and with the spine can cause an elevation in blood pressure. So that's why you need to find someone who knows how to marry those three things together versus only looking at the physical, only looking at the chemical, or only looking at the mental. And you need to see how those three things intertwine. And guys, that actually is the whole premise of chiropractic. Isn't that amazing? That it's all physical, mental, chemical. At the end of the day, you're going to think this: the body is stupid, the body makes mistakes, and I just have to manipulate it. Or maybe the body is magnificent and it's smart and it's not messing up. It's just adapting to the things I'm doing that could be messing it up. And so that's why, guys, the best place to start is the inflammation talk that's coming up tomorrow, April 4th at 6:00 p.m. That's an in-person event here at Exemplify Health Center. Go to the top of the page or visit Linktree in order to register for that. Or our next one's going to be April 27th, which is on a Thursday at 6:00. Get registered for that. And I promise you guys, when you start making these changes that we go over, the only thing that can happen is that you start getting better and that you start healing. But the great thing is that it is up to you. The bad news is also can be that it's up to you, that no one's coming to save you. I can provide you direction and I can tell you where to go, but ultimately you're the one at the end of the day who's going to have to make those changes as well. So guys, make sure you go ahead, go to the top of the page and get registered either for tomorrow or for the one on Thursday, April 27th at 6:00 p.m. So are you on, guys, a low salt diet? And if you are, make sure you go back and rewatch this. Make sure you share this with other people. And hopefully you get a better perspective on salt. You have a better perspective on potassium. You know how blood pressure medications work. And you know that where you actually need to start is maybe you need better balance between sodium and potassium. Make sure that you are getting enough potassium, which basically, guys, is coming from veggies, coming from even some fruits. It's even coming from some organ meats. But some of the best sources of potassium is not going to be tied to sugar. That's why one of my favorite sources of potassium actually coming from avocados. But the only problem is you need about 6 to 7 large avocados in order to get how much potassium that you need every single day. So guys, thank you again for watching. Make sure that you please share this video. I hope you have a great, awesome rest of your week. Make sure you like our page. We'll continue to give you a lot more great content. So just stay tuned. Over the next week, we'll be giving you a lot more great content. I hope you guys have a great night. Be well, be blessed. And as always, remember who you are.